Good afternoon, everyone. Thank you for joining me. This presentation is on HIV and HCV infection among people who inject drugs in Eastern Central Canada, and I will turn off my camera so you can see the entire slides. Le réseau sur VUDI is a HIV and HCV surveillance network among people who inject drugs since 1995 in the province of Quebec. It includes 8 different health regions and the city of Ottawa, and is part of the Canadian tracts since 2003. This presentation is only on SURVUDI results. The objectives are to describe HIV and HCV prevalence and to examine trends in HIV and HCV antibodies incidence and in use of injection material previously used by someone else, namely syringes and material other than syringes. The study participants must be active people who inject drugs. They must have injected in the past 6 months, and they must be at least 14 years old, speak French or English, and be able to provide informed consent. Most participants are recruited through harm reduction programs, about 90%, and others are recruited through several health programs. A questionnaire is administered by an interviewer, and oral samples are collected for anti-HIV and anti-HCV antibody testing. For analysis, we used data available until March 31, 2019. Several visits by the same participants are linked using an encrypted ID. The bootstrap method was used for incidence trends analysis, and Wald tests from generalized estimating equations with Poisson regressions and robust variance were used for other trend analysis. And now with the results. Since 1995, 15,416 people who inject drugs completed more than 30,000 interviews. 75.5% were men, with a median age of 36 years old for men and 30 years old for women. Regarding substances injected in the past 6 months, during the last 10 years, 68.7% of participants reported injection of cocaine, 63.7% of participants reported prescription opioid injection, and 33.7% reported heroin injection. For antibodies prevalence, we observed a prevalence of HIV of 12.8%, prevalence of HCV antibodies of 62.1%, and both HIV and HCV antibodies were observed for 10.9% of participants. This figure shows the HIV incidence rate over time. Between 1995 and 2019, the overall HIV incidence rate was 1.7 per 100 person-years. Specifically, we observed 329 seroconversions among 3,935 repeaters who were initially HIV negative. And over time, as you can see in the figure, the HIV incidence rate decreased significantly from 5 per 100 person-years in 1995 to 0.3 for 100 person-years in 2017. Between 1997 and 2019, the anti-HCV incidence rate overall for the period was 19.6 per 100 person-years. We observed 633 seroconversions among 1,343 repeaters who were initially HCV negative. As for HIV, anti-HCV incidence significantly decreased over time, with the lowest observed in 2016 at 10 per 100 person years. This figure shows the use of injection material previously used by someone else. In blue, syringes, and in orange, material other than syringes. There was a significant decrease in syringes previously used by someone else between 1995 and 2015, and then from 2015 to 2018 it was more stable. In 2018, 12.7% of participants reported using a syringe previously used by someone else. And for material other than syringes, it was stable between 2007 and 2010, and from 2010 to 2018, there was a significant decrease in the material other than syringes. We should mention a few limitations of the study. First, it's a convenience sample, meaning that our sample may not be representative of all people who inject drugs, but probably more of those who frequent harm reduction programs. The information was mostly self-reported, so possible social desirability and recall biases may be present. HCV antibodies mean that we don't have information on active infection. The current measure of incidence captures only first infections. Regarding strengths, the SurveyD network is ongoing since 1995. It's a very large sample with a good representation of multiple regions and urban as well as rural settings. And we have good collaborations with community organizations. In conclusion, encouraging trends were observed in HIV and HCV antibodies incidence rates, and also in the use of syringes, as well as material other than syringes previously used by someone else. But the HCV antibodies incidence rate remains very high. Injection with syringes already used by someone else has decreased significantly, but more slowly in recent years, which is a cause of concern. And we observed a significant improvement for the use of at least one item of material other than syringes already used by someone else, but it remains higher than for syringes. A few solutions may be to diversify the strategies for material distribution, to strengthen prevention message, including concealing about material others than syringes, and also regarding drug leftovers. Finally, thank you to all participants, and thanks for the funding from the Ministère de la Santé et des Services Sociaux and from Public Health Agency of Canada. And thank you very much to all collaborators, interviewers, and community organizations. And thank you everyone for your attention.